we have failed. All right. Thank you very much. Good evening once again. Ladies and gentlemen, we are recording this meeting. I must mention that. So by joining this meeting, you have consented that we can record your contributions, and maybe even your image will be captured and the sound. This video, after that, it will be uploaded on my YouTube channel, and perhaps it will begin to circulate. Maybe other people will pick it up from internet. Just some few rules before I get into the purpose of the meeting. Please, you are not allowed to unmute your mic unnecessarily, or even your video unnecessarily. Let's be intentional. Whenever you are requested or you are asked upon to ask some questions, that's when you can unmute yourself. For the video, you can have it remain muted, or you can unmute it depending if you have enough bundles. Whenever we want to ask questions, when that time comes for questions, you can ask one question and you are brief. And let us be polite when asking questions, and let us use the technology to raise your hand. Unless you have failed to click or to find the option or to raise your hand, you can excuse, and then we will allow you. And we will also allow people to comment. So today, this evening, we have Dr. Edwin Mumba, who will join SmartVersity Book Club. This is the book club where we read and review different categories of books. When we read books, we believe that we can inspire ourselves, be acquainted and empower ourselves with the knowledge and the skills that we need, and contribute to ourselves, the community, and the nation at large. And we want to believe that when we are informed, we can make right choices around us. Beyond reading, we do have conversations by having an expert in a certain field to talk to us, so that we can acquire more knowledge and have an opportunity to interact and have ask questions and receive answers. So today, we are privileged to have Dr. Edwin Mumba. Dr. Edwin Mumba is a registrar, is a psychiatry registrar at Chainama Hills Hospital or Clinic here in Lusaka. And he's an accomplished doctor. I think he has been, he is an expert. He has been around for quite a while, both in academia and practicing his profession. And he has worked with Rockview University and other institutions. I believe anything that I have left, Dr. Edwin will be able to pick it up. Allow me to read something before we get into, we allow Dr. Edwin. We are discussing men's mental health awareness. Men's mental health awareness refers to the recognition and understanding of the unique mental health challenges that men may face, you and me, as well as the promotion of mental well-being and support for the men's mental health needs. It involves raising awareness about the specific issues that can affect men's mental health and challenging the societal stigma and the stereotypes that may prevent men from seeking help or discussing their struggles openly. That's why we are here to have an expert. And let me say that historically, there has been a cultural expectations of men to be stoic, self-reliant, and tough, which can create barriers for men in seeking help or support for their mental health concerns. This can lead to underreporting and reluctance to seek help, resulting in higher rates of undiagnosed and untreated mental health conditions among men. Therefore, this evening, let's welcome Dr. Edwin Mumba just to go through mental awareness and just to enlighten us. And at some point, we will invite some questions. Good evening, Dr. Mumba.
Good evening, Mr. Mwila. Good evening, all. So thank you for according me this opportunity to make a presentation on men's mental health. So actually, this will be an interactive. It will be an interactive presentation. I'm just trying to upload my slide so that we can get going.
Sure.
Just a minute. Okay, are we able to see the screen I've shared?
Oh, not yet. It's trying to start sharing, but not yet. We give it a moment. Okay, yes. So
that's shared, right?
Yes, we have it. So maybe you can push it in the presentation mode so that we can have the full screen.
Okay, let me just try to navigate there. Okay, let me. Okay, is this okay?
Excellent, thank you.
All right, okay. So with you this evening is Dr. Mumba Edwin, going to take you through men's mental health. I'm a registrar psychiatry at Chainama. I've done a Bachelor of Medicine and Surgery in medicine. I did my Bachelor of Science in Human Biology as well, and also I'm a public health specialist. So sometimes we even go out to give what is public health awareness in terms of mental health. We also give other services, stand for people with disabilities, especially those who are actually maybe abused, could be sexually, and they need representation in the court, and so many other services, including treatment, individual treatment, and also counseling. So our presentation is going to be actually everyone. Some people also need to participate because certain areas I might be asking questions when we reach on a certain slide. Okay, so let's get going. Our outline will be what is mental health? How do mental health problems look among men? Then we'll look at the illness continuum. We'll look at suicide. We'll look at taking care of yourself, being your brother's keeper. Then we'll go on and look at the question because I was sent, Mr. Mwila sent me some questions some time back. So we're going to look at some questions. I'll try to run through and answer those questions. And they are quite bulky, but I will try to look at them, and also other questions from other people as well. Okay, so before we get into this topic, there are so many myths about mental health. And if maybe anyone can tell me any myth they know about mental health in men or mental illness in men, they are free to give me any myth they know. Anyone who knows a myth about mental illness in men and mental health in men as well? Hello?
All right, let me open the floor. I think some of the mental health, I think that are common, maybe with men. I can say those who are married, some people they will say is not normal because the wife has done something to him, where they would say "Mulisha" in the local language. Those are considered like this man is not normal. Thank you.
Okay. Yeah, so yeah, so that's one of the myths. People say good understanding, good relationship with the wife, able to actually follow whatever the wife says, and actually the marriage is going on, or they'll say that this person actually has been put maybe in a bottle, or they have done something to this person. Any other myth we know about mental health in men? Okay, true or false? The following are the myths I came up with. Myth number one, they say that Mwamuna Salila, men don't cry. Is this true? From the audience, is this true that men don't cry?
The myth is
True.
men don't cry.
Yes, that's a myth which goes wrong.
Kukosa,
That's myth number one. Yeah, that
kukosa.
Mwamuna Salila, men don't cry.
So we have
Okay,
Mr. Jones is saying false.
it's false. Yeah, Mr. Jones has responded. Actually, men cry. We should move away from that, because also men are people as well. They've got emotions, they've got feelings, and also behavior, which can affect their mental health and also their thinking and psychological living. The other myth, let me just go. Okay, someone has also sent us. Okay, Chabo Tamiowa said, false, we don't just show it. Yeah, we cry, we don't just show it. Okay. So the next myth is recovery from mental illness is not possible. Is it true or false?
It's false, but the myth has always been that there is something that remains. So it's not 100%. That's the myth. So it's false.
Yeah. So if you look at, it's a false, yeah, it's false. If you look at there's mental illnesses and medical illnesses. So medical illnesses examples are things like malaria. People recover from malaria. There are medical illnesses like cancer, certain conditions, people can't recover from them. They'll be like diabetes, hypertension. It will be very difficult for someone to recover from that. Even here in mental health, there are conditions which actually someone can recover from them. And there are conditions which you need, which are actually are treatable. You can treat them, someone becomes functional and contribute to the society. And others are curable, and someone will be living actually well and won't have that mental illness just like that. So that's how it is. So the next myth, going to the next myth, that's that, okay. The myth number three, they say that people who die by suicide are selfish and want to die. So we've seen people like, if I can ask a question, if you find someone actually, or the police found someone who had taken doom and they are dead, you hear that, oh, Banamumenya, they kicked that person, they hit him because he did something and forbidden. He's not supposed to kill himself. Or someone who almost committed suicide, they recovered, they'll be beaten. Instead of actually subjecting that person to treatment, intervention, so that they get better, but that person will be beaten, actually aggravating the mental illness someone is having. And the best thing is that you need to intervene, help them, they receive therapy, and you get the reason why they are trying to commit suicide. Then the other myth is that you cannot have a mental illness if it does not run in your family. Is this true? Myth number four, you cannot have a mental illness if it does not run in your family. Is this true?
It's false.
Yeah, very, very false. So we find that if you look at mental health or mental illnesses, you find that there are certain mental illnesses which are caused by due to certain factors, even if it doesn't run in the family. And every person is prone to mental illness. There's nothing like, no, because this family has got mental illness or they've got history of depression, that's why they're having depression, or they've got history of a certain condition of seeing things, having disorganized behavior, that's why they're having that. No, anyone actually can succumb to this. So no one actually is immune to mental illness. The other myth is alcohol does not worsen depression. That one also is false, actually. If someone is depressed, they resort to abuse of substance, including alcohol, it will just aggravate the depression and also other conditions or mental illnesses. So alcohol is not the way out. Actually, you're burying yourself, you're bringing out another mental illness. Myth number 6, mental illness is a result of a demon possession. Mental illness is a result of demon possession. Is this true?
It's false, but
Of course.
it's false, but some extremists would say he has a demon of mental challenges. And maybe you can also respond to this comment from John Mumba, who mentioned, I think he said, I don't think mental illness is a genetic disorder or a problem. I think, sorry, I just to bringing you back to this comment, I realize it's an important comment.
Yeah, actually, I've seen it. So, Mr. John Mumba, actually, mental illnesses, actually, they are both ways. So they are genetic and as well as they can be caused by. So you find that anxiety, someone is having an anxiety disorder, it can run in the family. Someone having depression, it can run in the family. Someone having that condition, we call it schizophrenia, but the other public or psychotic disorders, the public call it madness, and we don't allow actually using derogatory terms to or referring to patients with such terms. So you call it psychotic disorders. It can run in the family. So mental illnesses run in the family. And you find that actually, if both, especially your first degree relatives, like your brothers and sisters, had a mental illness, you got a higher chance of actually developing that. And actually, what can prevent you developing from that is by taking care of yourself, not abusing substance, and making sure that your psychosocial welfare is well taken so that you don't dip in that. So that genetic component will just be like a predisposing factor. Just like if you look at hypertension or diabetes, it runs in the family as well. We find that it can run in the family. There are those due to lifestyle, they will develop it, and there are those who has it through genetic cause. So you find that you have that thing which can predispose you to diabetes. But due to lifestyle, you find that someone can do diabetes. So that the lifestyle
to like you are far, you are away from the mic.
So yeah.
Okay, okay, thank you.
Yeah. So that's what I was saying. I was saying that mental illnesses can run in the family as well. So they can be genetic. So they are genetic as well. Okay. So yeah, so we're at mental illness is a result of demon possession. So that's what most people know. You find that before people bring their relatives to the hospital, they'll first take them to what's this? They'll first take them to a traditional. Once they see, then they'll bring them to the hospital. And the other thing is that long time ago, people used to have certain conditions. They are what are known as mood disorders. We call them mood disorders, where your mood is affected, like the depression, someone becomes depressed, or the manic episode. Some people in other languages, they will call it. That's one of the local names in Gulu. But that was a manic, a mood disorder. And what they would used to do is that they used to subject them to drum beating, and that patient is dancing the whole night. And they find that after some time, the patient gets better. They are starting order. It's part of treatment, they will get better. So that's why it's used to see that those people long time ago in the drumming up, that was just part of therapy because of less study. We didn't know that actually they were depriving sleep to that patient who was dancing the whole night. And the other myth is mentally ill and mentally restored individuals are unpredictable, violent, and dangerous. Is this true? Is this true? Okay,
I
this
think
is not true.
we can say it can be both. I think we have seen some who are mentally disorder where they become so violent and unpredictable. Yes, and we have seen some who go into isolation. I think for me, my observation or experience with encountering such people, it could be 50-50. Some violent, some they go into isolation where they are just alone. Thank you.
Yeah, yeah. So according to research, it has shown that actually people with mental illness are victims of violence. So there was this scenario: a mentally ill man in the society was being stoned by children. And then he retaliated and it became an assault. And then the society came in, beat up that person to near death. So that's how it started. So people already know that before this person reacts, they all know that this person is violent. So before this person reacts, is coming to me, let me respond. So they will try to actually do something before that person does something. And that person, you end up harming the other person. So in most cases, most of the cases is that these patients are actually victims of violence. Yeah. Okay, thank you for that contribution, Consilia. Thank you so much. Okay, so those are the myths. Those are the myths we have. Do you have any contribution from other people? Okay, so let's continue. Just that, yeah. The other myth is that men don't have problems with body images. This is also false. Men also experience such, just that they don't share with other people. Then the last myth is men are people too. So men are people. So we should know that men are people as well. So they also experience all these things we talked about. So we should bear in mind that also all these, they also experience what's this trauma as well, and they cry. What's this? They all experience. So all these myths actually affect men. So these are the things we find that which will actually show that men are also people. They cry. So if there's a woman here, you should know that a man cry, just that they don't expose. So someone told us that they won't expose themselves. They also experience panic attacks. So you don't just see, you find that this is if your husband having problems with sleep, waking up early, you have to get consent, having actually sleep interruption, all those, we find that those are anxiety presentation. Yeah. So there's also a myth. There's also someone has posted a myth, sorry, to take you back. Mr. Justin Kango saying that recovery from mental illness is not possible. And the question is, does recovery depend on the cause of the illness? Yes, that's a good actually question. So, like I said, recovery from mental illness is very much possible and occurs. It's just like the medical conditions we have. There are people actually, certain conditions in medical conditions are curable and treatable. So even mental illnesses or mental conditions, there are those which are curable and there are those which are treatable. So it's the same, people recover. And actually also the cause, the recovery depends on the cause. So for example, you find that genetic cause of a mental illness, that one actually will affect recovery. So if you find that genetic cause coupled with less support from the family, it will take time for the patient to recover from that mental illness. And you find that actually that will be a chronic condition and the patient can be on medication for some time or for life. That's how it is. So equally, in mental health, there are conditions which are treatable, there are conditions which are curable. In medical conditions, there are those which are treatable and those which are curable as well. So we continue with our topic, our presentation. So yeah, men are people as well. So men, they do self-harm and they use lethal means. They also have eating disorders as well. So you find that if you're looking at eating disorders, you find that in most cases they are common in females, and this is why you find that maybe someone has started starving so that they lose weight, and at the end you find that they get into a dangerous weight loss, which actually takes them to the hospital. That's one of the eating disorder. Others will find that they are eating and engaging into behaviors which reduces absorption of whatever food they eat, could be inducing vomiting or actually inducing diarrhea by taking certain drugs. Obviously, if I have a woman, if there's a woman on this page, they can attest to that. Men also go to therapy. Men also go to therapy. So if you find a man in the society that a man has gone for psychotherapy, that's a weak man. No, that's wrong. You need to open up to vent. Because if you can think that you're strong, but what you are going through is just a predisposing factor. So it doesn't mean that if you're going through stress in life, the only condition you can develop is depression. No. You can develop a psychotic disorder where you start seeing things, hearing voices. And that's why people start saying, no, this person has been bewitched. But they never knew that this person was going through stress in life. That's why they have started hallucinating. And then they will engage traditional healers or herbalists, and they will suspect that this person will bewitched and they will bring some problem in the family. Men have trauma as well. So many traumas just that they don't share. Men have body image issues. Men are abused. So if you look at GPV, fight against GPV, you find that if a man has been beaten by a woman and goes to the police, and actually you can even predict that case won't go anywhere. And there are centers where people would say that they have been laughed at because being a man and being kicked by a woman shows weakness in that man, which is not true. They also get abused. Men deserve support. Just like any woman, a man also deserves support. So we need confidence. We need people we love who we can share our problems to, and also we get comfort so that we don't tip into a mental disorder or mental illness. Men feel things as well. They become emotional. Men need love and care. It's not just the other gender. Men also need love and care. We all need love and care. Okay, so any question on this or any contribution? Someone wants to add something on this page before we move to the next page?
All right, thank you. Let me ask a question. Just where you mentioned that men do suffer, is it a body image disorder?
Yes.
Can we
Yes.
say maybe people hide in the name of fashion, or just they want to define who they are by going through some kind of body modification? I think the Western world, body modification, it has gone so advanced. But in our setup, like it is right now, it has not yet advanced, but there is just a little where we are seeing body piercing, body art, and all those things. Can that be associated to some extent with what you have talked about as body image disorder, where someone wants to enhance and just have that look, which they cover and say this is what they want? Thank you.
Yes. So yeah. So in our countries, it's not so like you can't see it easily because we don't do plastic surgery that can actually change your appearance. It's very rare. But you find that in the Western world, people actually go for plastic surgery. They will change their sexual orientation. They even change one of their body part. If they think that their lips are flawed, they think that their nose are flawed, they will try to change that. So that's one of them. So that they change their image and they satisfy what they want. So they don't usually present in a psychiatric hospital. Most of them present in the surgical unit so that they can change that body part. Okay, so yeah, John Mumba, that's the greatest. That's true. It's the greatest myth, very greatest myth. Yes, because people think that once someone gets a mental illness, they will never recover. That's it for them. But people recover, people go back to their day-to-day function, and they become a function in the society, actually. I've seen this in so many people. They're directors managing other people, but they're having certain conditions. So please, you see someone with a mental illness, you rush them to the hospital, you rush them to an appropriate person so that they get treatment. Because what happens is that if you take long to treat that person, the brain changes and it can actually become permanent and very difficult to treat. The reason I find that certain conditions might take long to treat and recover is because people also take long. You find someone has fainted home, you take them to the hospital quickly. But find someone that is seeing things or someone is low, you just first start saying that this person just wants attention, or maybe this person has been bewitched. You start taking long, start taking them to other areas or other non-medical centers such as a herbalist. So there's one was posted something here. Consilia, I have noticed that men go through a lot mentally. However, what makes it so difficult for men to share their pain or cry out when emotionally disturbed? I feel hiding pain because there's so many problems in men, unlike women who freely express themselves. Yeah, very true. That's very true, Consilia. And that's why I find that if it comes to committing suicide, a man will use a lethal means to end their life. If a man says, I would rather die than live, be careful. They need to be admitted. They need help. They need treatment. So that's very true. Why do some men feel pressured to show their naughty side among friends? Also, to what extent can social drinking socially be a concern regarding someone's mental illness? Okay, yeah, so it's all about why do some men feel pressured to show their naughty side among friends? So that's just all about, it's all about pride. They just want to show their pride to their friend, and also depends on the conversation they're having. And you find that actually uh, that affects someone's mentally because that naughty behavior, we know if someone is married and they is discovered as having naughty behavior, the family will be disintegrated and that will pose a risk of mental illness on the person. Any type of mental illness can affect that man. So even the naughty behavior, actually, you can check, is it behavior normal or not normal? You find that even person, there are people, there's what we call personality disorder. Certain people with personality disorders, actually, they engage quite too much in naughty behavior. So it's very difficult to identify a mental illness. So you can think as if you're just having a normal chat with that person and giving those claps for that person. But if you sit quietly and check the behavior of that person, it can point towards a personality disorder. So even your personality, the way you are, your character can become affected and become a mental disorder. Also, to what extent can social drinking, socializing be a concern regarding someone's mental health? Okay. So in come to drinking, I know we are talking about alcohol. Yeah. So alcohol is it's not an illegal drug. It's allowed. People are able to take it. But it becomes a problem when it affects your day-to-day function. Hear me this. Drunk driving. You're driving while drunk. It becomes an alcohol use disorder. It's a problem. You see that you've got maybe a medical condition, and then you know that alcohol, when you take alcohol, aggravates that condition, becomes an alcohol use disorder or problem. If you see that when you go home, because of the alcohol you take, you cause problem, becomes an alcohol use disorder. You see that maybe because of the alcohol you're taking and you're not spending money on your family, that money is going to alcohol, it becomes an alcohol use disorder. So it's affecting your social and occupational functioning. You can't go for work because yesterday you're taking too much, you're trying to nurse your HO alcohol use disorder. You're trying to lie, you're spending most of the time taking alcohol, looking for money to buy alcohol use disorder. So there are so many things. So if those are not affected, it's not a mental disorder in terms of alcohol. Do all mental health issues require seeking help from medical centers? Are there ways of preventing mental health disorders or problems? What are they? Yeah. So it's all about awareness. It's all about awareness. So what happens is that if you see that there's someone who can help that person in terms of their mental illness, well and good. But if you see that those people are limited, they can't go beyond that, it's better you refer them to medical center. And by the way, it's better you receive specialist or specialized treatment than you go around before you go to that area. Yeah, so that's my response to John Mumba. Okay. Is there actual medical help in form of drugs for some of the mental illness, or perhaps it's all therapy talking? Yes. So actually, there's therapy. When it comes to drugs, there are two ways. When it comes to drug abuse, there are two ways here. There's therapy, psychotherapy, and there's also drug medical treatment where I use drugs. So what will happen is that specialists will see if a patient needs drugs. So for example, someone who has been taking alcohol heavily for a long time, and you know that if they stop, maybe they even fit if they haven't taken alcohol. So that person actually can tip into what we call it, it causes unconsciousness and they can die. So they need to be detoxed. So we find that in drug abuse, patients need to be detoxed. That's why they receive those drugs. So we detoxify them. We give them certain drugs to prevent them from getting to a withdrawal phase. Because there's a phase where you haven't taken any drug. There's no drug in your system. Your body is already used. So you find that your body system will become so hyperactive and you start experiencing certain symptoms. Others can even see things which other people can see, shaking, sweating. Others can have insomnia, even with cocaine, cannabis, and other things. So yeah, and also there are certain drugs we use. Apart from those drugs used for detoxifying patients, there are certain drugs we use to reduce on the cravings. You find that the person quite right, you detox them, but the craving is there. When they go home, or just after discharging them, they pass maybe by a nearby beer center. It's kicking high in terms of music. They'll have that craving. Or they see a bottle of beer, they'll have that craving. Or they talk to a friend who they smoke with cannabis, they'll have that craving. So there are drugs which we give to reduce on craving, to reduce on craving, which are known as anti-craving drugs. And also there are drugs which we give to reduce on the abuse, known as anti-abuse drugs. So you find that if you take this drug, the example, take that drug while they have taken that drug and start taking alcohol, you find that they'll start experiencing those symptoms which are so severe, they'll stop taking alcohol. And you know that the brain will associate that period, taking of alcohol, with a symptom. So whenever you, for example, you see something, you can remember those symptoms you experience. Obviously, you've seen it. If something happens to you, maybe you see you're with your friend and something bad happens during that time, and maybe you separate. The moment you see that person, it will remind you of what happened during that time. So the brain associates itself to the situation. Yeah, so there are drugs. there are drugs which we give in patients, in people who are actually abusing illicit drugs or illegal drug. That's for Jones. Jonathan Scombe, is there any mental health reason why men generally die before women? Or is it simply biological or social? What can men or even their female partners do to remedy? Yeah. So psychosocial problem. So many tasks given to men and not opening up. So men, if they're going through, because of those myths, they're going through hardship, they won't share. Men have been given so many responsibilities and actually find that maybe this is a man, needs to provide for the family, needs to do this to the children, needs to do this to the wife, and also needs to make sure that his workplace also he achieves certain goals at his workplace. All those things, if they actually are not achieved, someone will start maybe facing anxiety symptoms, unable to sleep, palpitation, sweating. So what you should know is that the mental illness is connected to your body. So mental illness actually can result into medical condition manifestation. The heart gets affected because of chronic fatigue. You're always stressed, you're always anxious, all those things. So those are the reasons. And if you look at women actually, when it comes to problems, they too share, like Consilia said. If there's a problem, they'll easily share. And they have got actually the habits of seeking medical assistance. They'll easily go to the hospital, get treated and come back. But for a man, until you see that man is down, that's when you see that this man is ill, they will keep it to themselves. Okay. Is detoxification something that is done in a hospital? Yes, Jones, we do that. We do detoxify. We did detoxification. If there's any patient who needs detox, quickly you send them through. How best can one, especially as women, manage to convince men to share on what may be bothering them when it mostly could lead into depression and later into mental illness? Men are just difficult to open up on issues. Okay, so there's a myth which says, how can you share a problem to a problem? Sorry for that concept. They'll say that, how can you share a problem to a problem? So it depends with the situation, how you relate with that man. So when it comes to helping in terms of house requirements and taking care of the house, I think you need to have concerted effort. If you're able to contribute something, contribute. But you find that men will expect something for a woman once they share that. And the men will think that if you share a problem to a woman, you are weak. But we're supposed to share. A woman, you're supposed to provide that platform so that a man can share their problem. And later on, you don't actually, people come that actually I share this problem to this woman, but later on during the quarrel, it was used against me. So those are the things actually people point to. So the best thing actually is just to provide a platform so that these men can actually share the problems. Okay, so there are so many questions popping up. How do traditional patterns of grieving among men, such as suppressing emotions or being confronted with unexpected traumatic experience like handling the disease, impact their well-being adversely? Moreover, how can this pattern be modified sensitively within the bounds of our cultural customs, avoiding controversy? Okay, yeah. So, like I said, you're suppressing your emotion. It's more like when you suppress your emotion, it's more like you have syphilis and you don't go to the hospital. So you're suppressing the emotion. That's your emotional being is being affected. So it's predisposing factor. So you're suppressing your condition. You need help. So you find that if you go through a traumatic event and you haven't been counseled, and even handling the deceased, all those things will impact you gravely. So you need maybe psychotherapy, a talk therapy, you talk to someone, you open up, they advise you, they do therapy, they do psychoeducation, you get better. You're reducing on the predisposing factor. But you find that if you keep it, it's piling. Another thing is piling, until a major thing comes in and precipitates the major illness. Could be anxiety, psychotic disorders, depression, other mood disorders, and other conditions. So that's how it is. So actually, we need to modify these patterns. How can we modify these patterns? Maybe by changing our culture. Actually, long time ago, there was this culture which they used to call insider, where men used to come together and they share those problems. And when you share those problems, actually, you are reducing on the stress on yourself and reducing the predisposing factor. So we should just say, actually, we need sensitization to say that even men, they need psychotherapy. Also men, they are injured emotionally. Also men, they get ill mentally. So I think it's just all about psychoeducation. It can start with you. Just from this talk we are having, it can start with you by disseminating this information and changing actually what we believe in, that men actually are strong. They don't cry. The men are also human beings. Okay, sorry. I think I missed you when you were talking about withdrawal phase. Did you say you give drugs, those recovering drugs addicts, to help them cope with that phase? How does that work? Yeah. So, Francine, sorry. Yeah. During what are known as withdrawal symptoms. So if someone has been taking substance, any drug for a long time, the body changes even how it works. So if someone hasn't taken that drug, it will try to actually upregulate. Because, for example, if that drug causes blood pressure to go down, heart rate to go down, or even to stop sweating, so you find that actually the body is insensitive to heat. So when someone actually stops taking that drug, the body will try to upregulate, so that it goes to a higher level, the blood pressure goes up, so that all the body organs are maintained. They will start sweating profusely. So we'll give those drugs, because that phase, if someone starts experiencing that, even the wiring in the brain has been affected, others can tip into coma and even die. So to prevent them from getting into that phase, we actually need to detox them. And actually you find that people are just discovered, maybe they were taking alcohol excessively and stays alone and discovered dead because they went into a withdrawal phase, they were not treated, and then they went into coma and then into death. So that's how it is. Okay. Obviously, I've answered your question, Francis. All right, let's continue. Just my internet is slow. Okay. Okay, so we look at what is mental health. Okay. So mental health actually affects how someone, sorry, not affecting. Mental health is the well-being of someone in terms of social, psychological, and emotional life. That's basically mental health. And if those are affected, we find that the thinking, the feeling, and the action also be affected. So you find that if someone is okay, the thinking, the feeling, the action will be well as well. So in mental health, all these three things can be affected. So there's another question just popped up. How best can one, especially as women, manage to convince men? Oh, haven't I? How affordable for most Zambians is it to help a young person who is hooked on drugs? This is how common among men. Okay, yeah. So the best thing is it's very affordable. You just bring them to the hospital, they'll be treated free of charge. Yeah, so just bring them to the hospital, they'll be helped. Yeah, bring them to Chainama, they'll be helped. Even other centers have got mental health wings, even the level 1 hospital. Just take them there, they'll be helped. And if they fail at that level, they'll be referred to the next level. That's how it works. So free of charge, they'll be helped. Okay. So yeah, so we're talking about what is mental health, just the well-being of someone, social, psychological, emotional, the well-being of someone's psychology, emotions, and social life. So you find that all those things, when you're having a social life, a psychological life, you find that the thinking is involved. To actually believe in something, to make opinion, make judgment, your thinking is involved. Also, to do certain things, it's action. You have to behave in certain way, talk in certain way, walk in certain way, and do certain things in certain way. Your emotions and feelings as well are involved. How you connect yourself in terms of sadness, joy, fear. So you find that if one is affected, it will affect the other. So for example, we give here for the feeling, someone maybe encounters a stressful life event and changes their feeling, the way they feel emotionally. So you find that even the thinking will be changed. Others will become judgmental. Others actually judgment will be affected. They will start thinking about maybe suicide. If they start thinking about suicide, they will commit it and do it. So these are the things which gets affected in mental health. They're interlinked. They are interlinked. Okay. Yeah. Yeah. So like I said earlier on, all the body parts are affected by someone's mental well-being. So your mental well-being eventually causes a medical condition. That's how it is. Having anxiety can result into diabetes, hypertension, heart disease, and other things. So you take care of your mental health, you take care of your body. So that's how it is. So there's what is known as the illness wellness continuum. So this is just like a phase in life. We actually move around this phase. So there are times where someone is in the comfort zone. In the comfort zone, there you find that you're just in the neutral zone. There are no symptoms, quite right, nutritionally, you are inconsistent, you get something nice, this time around you've eaten something which is not nutritious, like that. Exercises are sporadic, health there maybe not so high priority. Yeah. So from there, people can start going up to 7, 8, 9, 10. Okay, let me just check this response or question. As men, we would love to seek for help and share our problems, as society loves at men and they are mocked badly. Sometimes comments might seem to be a joke, such as wema wamengalanda so wema wamekukosa. Okay, yeah. With this in mind, how can we help society understand that men are human beings with emotions? Okay, yeah. So even from this, actually, from this chat we're having, and also from maybe if I would try to share certain researches, you find that due to stress and all these sentiments which comes from the society that a man is supposed to be strong, a man is supposed to say this, not supposed to cry, it is predisposing them to mental health. So we need to change actually the notion by actually doing public education and awareness so that everyone understands and we're able to move. I think we need, we can even pick it from here. So as we go in the society, we try to change the public notion that even a man is a human being, gets injured emotionally. And if you get injured emotionally, it can later on result into mental illness. It's just like, let's say, a certain body organ gets affected in your system and maybe gets a trauma. It takes, maybe you try to take certain medication, it affects your liver, you are treated. So the liver is getting weaker until it gets affected. That's how the mind is as well. And unfortunately, we only have one mind, one brain. You have got two kidneys, but there's just one brain. And that brain defines you. And if it gets affected, it changes you. So we need to disseminate this information to other people that actually a man is a human being as well. They are prone to mental illness. And when it comes to them, it becomes so difficult because men, we've got less social interaction and we don't share problems. And you see that if it comes to mental illness, you need social support, family support, so that they will take you to the hospital. Because that time when you're ill, the brain is the one which tells you that, no, do this, go to the hospital because you've got an abscess or a boil. No, go to the hospital because your body, you have got a body. But it's affected, it won't tell you itself that, oh, you see, I'm having a mental illness, let's go to the hospital. You meet people. That's how dangerous mental illnesses are. So we need to disseminate this information.
Doctor,
So we are
I will propose that I think you can walk through the presentation, the question. They will keep on asking the questions so that maybe we can give you time to finish the presentation and we can have time again to answer the question. I know it has been very interactive, but we allow you as well to present what you prepared. I know you respond to the questions, yeah, and then we will pick the questions because we have run out of time. Thank you.
Okay. All right. Okay, yeah. So there's this continuum, yeah, where someone is just on the middle. They have no symptoms. Nutrition-wise, they're inconsistent. You've eaten something, wajako kamushe, this is nutritious. Exercise is sporadic, and health is not a priority. And others find that they can get higher into good health, whether by regular exercise, good nutrition, wellness education. Yeah, like this, you're going for wellness education, you're getting mental health education, and also education about other conditions and medical conditions. And also minimal nerve interference. When you say minimal nerve interference, that's where maybe certain stress, psychosocial stressors actually impinge or has got an effect on your nerve and can result into anxieties. And others there are times where someone can get into optimal health, where they are 100% functional, they are developing themselves, active participating in the society, and also a wellness lifestyle. So this is a continuum. Even now, yourself, you can assess yourself where you are, just on this continuum. And then there are times where someone gets into the poor health, they start getting treatment, surgery, and even maybe gets into it. So there are times in life. So people, we swing in this continuum. So even now, you can assess yourself where you are. Okay, so we proceed. Okay, how do mental health problems look among men? So one of the mental health problem in men is withdrawal. So they'll start withdrawing. So consider, you see that a man will start withdrawing, just maybe even isolating themselves. That's one of the symptoms. Anger management become a problem. You find that someone become irritable just over a simple issue, showing that there's something going on in their mind. So it doesn't mean that, if you're interacting with someone, they respond to you in a different way. You even fail to understand. Just say that there's a mental health issue here. You need to help someone. There's a reason why someone has answered you angrily, but they need help in that phase. Excessive alcohol and substance use. So you find that if someone actually abuses substance, it will become so excessive. They take alcohol. This is a man who's functional. They will take alcohol. They are functional alcoholics. They will take alcohol. They come to the hospital home, and maybe they take alcohol occasionally. But you discover that someone starts taking alcohol so oftenly, the dosages of amount of alcohol they take or substance increase, and it starts affecting their social life, occupational life, then sense a mental health problem. Interpersonal conflict. So we find that interpersonal conflicts will increase. So it could be at work, in marriages, or with other people. So you should see something, you should see a problem in that. Just say, maybe just help that person to receive some therapy or treatment from other people. So help your friend in a good way. Addictions will come in. Addictions will come in, such as gambling, and especially gambling will increase because most of the time it will be spent there. And you find that it becomes gambling, there are certain things you look at. Most of the time, time is spent on gambling, repeated lying. Someone will tell you that they gamble. So those are the diagnostic criteria. And in most cases, you find that they'll be gambling huge sums of money, and that affects the person. It's part of it's part of a mental problem. So even gambling starts affecting someone's social and occupational life. And in mental health problems, if whatever condition someone is having affects their functioning, contribution to society, social and occupational life, then it's a very dangerous condition at that level. Others will actually engage into pornography, they engage into sex excessively, they'll start abusing drugs. Others will find that they'll become workaholic. A man has knocked off from work, hasn't come early at home. They knock off at 17, they're coming home at 24, at 22 hours. They're still getting comfort there. So those will be part of the symptoms of a religious. So you find that due to a mental illness, you find that there's a problem. Being religious is it's not something good. It's actually required. We are Christians, others are Muslims, others are another religion. It's okay, but they become over religious. You need to plan on something. Let's pray about it. Let's pray about it. And results are not coming. You've never seen before, someone will start behaving a different way. That's part of symptom. And then these are just predisposing symptoms. They're showing you that this person will tip now in a full-blown disorder. So if they come to the hospital, we'll use certain criteria to say that now this person is having this condition. This person is having this. So we won't just say someone is having a severe depression or major depressive disorder. No, we'll look at certain symptoms, and we'll look at the criteria. If they meet, say, major depressive disorder, but they started with sadness, which was a symptom. So there, if you intervened quickly, maybe by psychotherapy, someone would have gotten better. Others will even get into suicide. They will try to commit suicide, even actually be successful. So those will be symptoms. Even other symptoms can come in as well. Okay, so we've mentioned suicides, and in men, actually, you find that suicide, when they try to commit suicide, they will try to use lethal means. So you find that there are certain causes of suicide. There are certain causes of suicide. So before someone actually commits suicide, they will lose hope. So there are certain questions you ask: how they view themselves, the environment around them, and the future. So if you ask them, if they tell you that, my future is not so certain, my future is dark, then you know that this person actually might commit suicide. They will have poor judgment. So you find that even just a simple thing, they can get into quarrels or commit certain criminal activities, could be assault. And they just maybe want to get into the jail or the prison, so that actually they're removed from the society. Fear of living, actually, like I said, they'll say the future is not okay with me. And depression, when they get into depression. So you start seeing someone withdrawing, being sad, not thinking about the future, reduced concentration, appetite goes down, start losing weight. Others actually have increased appetite, even increased their weight gain. Just start thinking about depression, might be having depression, and they might commit suicide. Yeah, so triggers of mental illness in men, these are the triggers. Things like intimate partner stress. So stress from the partner, professional bullying, even at workplace, you can receive bullying. You find that maybe you're bullied by by your supervisor, you're bullied by your colleagues, a group of workmates. So that also can also trigger a mental illness. Otherwise, too much competition, people can engage themselves in certain way of living life, and it causes a mental illness. Sexual difficulties or sexual disorder. Because of such sexual disorder, they're having unsatisfied sex. So it can cause frustration and result into mental illness. And again, vice versa, mental illness can cause sexual difficulties because someone who's having stress can't have intercourse with a partner or their wife. They will have erectile dysfunction. Stress causes that. So there are psychological causes of sexual difficulties as well. Unemployment as well can trigger mental illness. Poverty, gambling, and substance use, like we said, they can trigger what's this, mental illness. Also, significant changes in living arrangements, such as separation. If someone is separated from the wife, someone gets a divorce, you find that because they get a divorce, they'll start abusing substance. That's a mental illness. That's a mental illness. So there are stories where people say, no, I got divorced. I got separated from my wife. Then I found this woman. This woman was abusing cocaine. I started abusing cocaine. Then she left me. Because of I got addicted, I continued. And I need therapy now. I need treatment. So that's how it starts. So this even a substance or drug abuse, it's a mental illness. It's a mental illness. Okay, why do more men die by suicide than women? So these are the major factors. Use of more lethal means. So like I said, if a man says they want to kill themselves, wow, they'll actually end their life easily. Poor health-seeking behavior. Like I said, a man who have poor health-seeking behavior, for them just to go to the hospital and get treatment is very difficult unless maybe the partner or the relative notices that this person is not well and takes them to the hospital. Bottling up emotions. So actually, it's very difficult for men to express their emotions, share their emotions. So if you bottle up your emotions, you're just actually piling up. You're predisposing yourself. You find that you just need one incident to actually get into a full-blown mental illness. Poor social connections. So poor social connections. Less people to talk to. When you say less people to talk to, confidence, people you love and you can share your information about. So it's better you identify if you have a friend you have a friend or someone who you trust and can share your problem. You share, you vent, you open up, they give you counsel, and then that will help you. But you have certain friends you share, they share the information to other people. That also is a predisposing factor because once you hear that, it will affect you and it will tip you more into mental health issues. Okay, so there's what is known as self-care. So here, there are ways in which someone can take care of themselves. One, in terms of your body. So eat healthy, exercise, hydrate, sleep. Sleep is very important, please. We need to be sleeping because if you are depriving your body from sleeping, you develop anxiety, you can develop depression or other conditions. Your body won't function well. So please, let's invest in sleeping. Avoid also abuse of substance. Let's not abuse substance because they can also result into mental illness and also they are part of mental illness. Achievement. So look for one area where you can try to achieve something like work or reading. This is a platform actually. It's a reading group where people come together and share the readings. So it's part of achievement. So you can try to set targets. Maybe you want to read something, write something, learn something, have hobbies, and also contribute to the society. No, it doesn't mean that contributing to the society you have to give money. There are so many ways in which you can contribute to society. Giving counseling to people, disseminating information, like we are saying, and changing the notion that people also men are prone to mental illnesses. Connections. When you say connections, reach out to someone daily. Who is that someone? Someone you love, you trust, or cares about you. That someone is supposed to be good for you, not just anyone else. So identify someone you can share your information, your problems with, so that at least you are counseled, you receive that therapy, and you reduce on the predisposition to full-blown mental illness. Enjoyment and enrichment. So enjoyment and enrichment doesn't mean that you get yourself soaked in alcohol or you start abusing other substance. No, find something you derive pleasure from, like music, cooking, could be watching something, a movie, or maybe spiritual disciplines, going to church or other things. If you have other ways of having self-care, you can post on the chats. We'll go through them. So these are the ones I just came up with. And also seek help. This is very important. If you feel overwhelmed, despite doing all the above, you've seen that, okay, I've been doing all the above, please seek professional help. You will receive therapy. You might receive even a relaxing drug, you get better. Because you're having so much thoughts, you're having anxiety, you can't sleep, your brain works like a laptop. You've seen that you're working on your laptop, you open so many things on the taskbar, you're working on so many things. The laptop will become heated up and it will become slow, even actually jam. What's the next step you're going to do? You're going to restart the laptop so that it becomes, start working properly. You are restarting the system. So that's what, even when you come to the hospital, your brain is actually affected. It's become slow. We need maybe therapy, you need even medication so that we calm you down, you get better. Okay, so this is we're still talking about the continuum and how you can get help. So if you find that you're getting down below the comfort zone, you seek professional support. You go to the professionals, you get support, you get treatment, you get therapy. If you're in the comfort zone, you need social support. Maybe someone needs to give you education about how you supposed to actually how you're supposed to prepare your meals in terms of nutrition. You're supposed to carry out your exercise, and how supposed to make sure that your health is supposed to be a priority. Then above that, okay, just need to continue following the self-care model. Okay.
I don't know, he's muted.
Okay. I've muted?
He's muted. He's muted.
Oh, Mr. Mwila?
Yes.
Yes.
Okay.
Yes, I'm here. I'm here.
Yes, okay, all right. Okay. Okay. So at the end, we need to be our brother's keeper. Let's not neglect each other. Let's meet, share our problems, help each other. Let's hold one another accountable. Your brother discuss this matter with you. Did you cancel? Why did you share it with other people? Let's allow vulnerability, please. We are vulnerable to mental illnesses as men. So you see that you're having mental challenges, problems, psychosocial stressors, or any other mental illnesses, and even medical condition or medical illnesses, which is actually causing mental illnesses. Please go to the professionals or find a confidant you have, share your problems, get help. Physical assistance as well. Let's have physical assistance. We help each other. If someone needs to go to the hospital to receive physical treatment, you take them there, or any other things you can share with your friend. Speak up for others. your friend is not there, then they become the topic of the conversation. Let's stop that. So someone is speaking ill about others. No, that one is a weak man and has got depression. No, that's stigma. You're stigmatizing people. No, that one is weak. The brain is weak. Has got psychotic disorder. Sees things. How we also later, but don't bring him closer to us. No, speak up for others. Because once you give support to that person, they'll get better. Because even in our treatment, is what we call biopsychosocial model. When you say biopsychosocial model of treatment, we're looking at the biological biology where you engage that. We're looking at the psychosocial part, how someone deals with certain condition. The social part. So everyone is involved in this management. So when it comes to management of mental illness, it's not just a profession. It's not just Dr. Mumba, it's not just psychotherapists. Even just you, a passerby, you make a great change on that person just by doing a certain help to that person. So please, let's be a brother's keeper and make sure that we reduce on the mental illnesses in men. Okay, so yeah. Let me just, okay, so that's the last slide. Yeah, so make sure the rest of your life is the best of your life. So for further support, you can reach me. That's my line, and that's my email address. So you can reach me. If there is anyone that needs help or any maybe a massive psychoeducation is needed, you can reach out to me. Okay, so now I can go through the charts and check out the questions and contributions. Yeah. So yeah, over-religious can lead to mental illness. I've learned something new. Okay, yeah. So when I say being over-religious, there are things, you see some people, some mental illnesses, that's how they start. So someone will tell you that actually, I've been told not to eat for 3 weeks or 1 month, not to bath for 1 month. People think as if this person is okay, is just being religious, but the mental illness is just kicking in there. Yes, we are. Okay. Yeah.
All right. Let me ask one question, Dr. Maybe. Thank you for the wonderful presentation. I can even make a comment since you have put your contacts and everything, you can encourage everyone. And I'm sure once I post this on YouTube, people will read through. I think the doctor is always available and responds on time. I'm sure when you call him or you email him, he will respond promptly. All right, Doctor, I think, wow, the world has become so small through internet. I came across a certain story, I think, which occurred between January and February. I think this story was published, I think, at Mwebantu and Kalemba, where you represented or to give expert views concerning the case where someone abused or defiled a 10-year-old girl, and you were giving expert advice because this minor, you said, she cannot defend herself. Now, in this case where we have so many cases of defilement, what causes, what kind of mental disorder that leads to men committing such kind of crime, just trying to have sex with a minor? Thank you.
Okay. Yeah. So when it comes to defilement, you find that by law, anyone below the age of 16 years, if I'm not mistaken, having carnal knowledge with them, that's defilement. Anyone who has a mental disorder and can't consent to sex is still defilement. So you find that people take advantage of such. So you find that maybe due to sexual disorders or sexual frustration, when you get to sexual disorders, people might be scared to engage maybe into having consensual sex with someone or intimate person. They would rather go to minors or they would rather go to people with mental intellectual disability. So because of that sexual disorder, they are scared of maybe humiliation or in terms of performance, people try to resort to these ways of actually having sex. Others could be maybe psychological, like I said. There are so many factors. And I think if I was given a platform maybe to present on sexual disorders, that would be better. So others find that it's psychological factors, maybe it's due to their upbringing, how someone was brought up, maybe during their life, they were abused sexually, they were abused mentally, or any other form of physical abuse. And you find that in the later life, they would prefer maybe they're just trying to do a payback to the person because they went through that, or they think that maybe being the other gender and trying to perform this act would be stronger. That's why I find that they will start actually having canon knowledge with people with intellectual disability and people less than 16 years. Yeah, I don't know. Have I answered your question?
Yes, please. Thank you very much. Maybe we can just go some few questions. I think we have had a long chat, but it's very exciting. I have seen only a few people dropped off, which is a sign that we have people enjoy the presentation. We can see the feedback in the chat. I think people they have enjoyed the presentation, and some are even asking if you can share the presentation. I think there is someone, I think that should be Mr. Okay, that's someone whose name is just Galax. I wish you had named your name. Someone who is using that phone is asking if it is possible to share the presentation. Yes, I think that's the question, or that's a comment.
Okay.
I'm wondering if we have comments, questions before maybe we call it a night. We give some time for doctor to go and rest. Questions, comments? All right, okay, thank you very much. Doctor, just one more comment before maybe we wind up. Just share with us some of the success stories and the examples that have been experienced in Zambia. I think there's so much that has been talked about, the mental health challenges, and mainly it's just from the negative side, and just a few success stories. Some may remain anonymous, and so that we can be, one or two people can be motivated what the government is doing, and perhaps even yourself, what you are doing or what you have done. One or two success stories. Thank you.
Okay. So one thing I can say, I am commending the government for this way of the new way of dealing with mental illnesses, because I've rolled out to all level 1 hospitals, general hospitals. It's out there. So I find that a long time ago it used to be difficult. Only people used to seek for mental illness treatment from China. But nowadays it's out there. If treatment is difficult, they'll be referred to the specialized hospital, which is China. So there are so many success stories. There are so many success stories. There was, I won't be mentioning names. There was a student who dropped out of school because of an anxiety disorder, couldn't sleep, palpitation, sweating. They went to hospitals checking if there's any condition. There was no condition. We started treatment. We put him drugs. We started counseling. So then later he came back. We wrote a letter to the school, went back to the university, completed. There was a student, another student from another university, was in drugs, abuse of polysubstance, different drugs, alcohol, cannabis, heroin. Actually, he even actually exchanged his vehicle, which was given by his father, with heroin in Chibolia. So we started counseling, we detoxified the patient, You had to put him on anti-cravings. It got better. It changed. Even became actually ready for the university. Went back to the university. And there was one also works in the works is works for one of the was ill, brought by the relatives, was unable to run his business and also go for work. Was actually full-blown mental. Started actually treatment, was in the hospital for a long time. Got better, made better decision, because the problem was that that person, because of the mental illness, made rash decision and divorced the wife. So when actually got better, they reconciled with the wife and got back. So there are so many success stories. I think those are the ones I can share. Okay.
All right,
Is
thank
that
you.
okay, Mr. Miller?
All right, thank you very much. I think
Okay,
we are so grateful for your time. I think we are winding up. I think we have gone beyond the time, like I mentioned, just maybe in less than 30 seconds, your last remarks at this moment.
Okay, so team and colleagues, mental illness mental diseases or disorders are real. They are there. And don't think that if someone smokes cannabis, those are the ones who are going to get mental illness. If someone has got a mental illness in the family, those are the ones, no, everyone can actually is prone to a mental illness. So because of what we go through, anyone can become ill. So let's stop using derogatory words such as madness and other words. Let's be brother's keeper. If there's a problem, you help someone. And actually, you reach out. If you see that there's a problem in the community, this person is having, you take them to the hospital, and then they'll be taken, or you bring them to the specialized hospital. So please, guys, please, team, mental illness or mental illnesses are real. They are there. And if you're accountable and okay, doesn't mean that you are actually immune. No, anyone can get a mental illness. Mental illness doesn't mean that having depression or seeing things and anxieties are real. People just pop up and say, I've been having sleep problems. I've been having palpitations. I've been feeling tired all the time. I fail to concentrate. I'm restless. That could be coming from a mental illness. So someone needs treatment. So mental illness, people, it doesn't mean that someone has to be psychotic, they have to see things or hear voices, or they have to have depression. No, there are so many mental illnesses. So many mental illnesses. I think that's what I can say. Yeah,
Well,
thank you.
that was excellent, Doctor. You have done justice, and thank you very much for spending your precious time with us, sharing your experience and the knowledge. I believe can assure you that this information will not only end with us who are on the call, but this message, your knowledge, experience, it's reaching masses, because I will upload this content on the YouTube and on the other social media platforms. So thank you very much for the impact that you are going to make and the impact that you have made on us. Thank you very much. We are so grateful, and thank you to the participants who labored up to this time. I know we have gone beyond an hour, but we couldn't stop because we need this kind of information. We need this kind of knowledge. We are a book club, SmartVersity Book Club, and we read, we study, we apply, and we listen from experts so that we can balance and have self-growth, self-education, and be people will remain productive to this nation. And without further much ado, I would like to thank you and see you next time. We will have another conversation with another expert in a specific field. And in the meantime, as usual, first week or second week of the month, we will review a book. And Mr. Justin Kamwa will be reviewing a book the first month of April. And the third week of April, just like this one, we are going to have another speaker. I will update the members of the WhatsApp group. Those who want to join the WhatsApp group, you can reach out the numbers on the YouTube and the numbers on my Facebook page. And then we will add you to the Facebook or to the WhatsApp group so that you can be part of the reading team. The team is inspiring for growth. Thank you very much and enjoy the rest of the evening. Bye-bye.
Bye.
Bye-bye. Good night.
Good night.